right, let's welcome our guest, John Falardeau, today. I'm going to give everybody a chance to start logging on here. I don't know what happened to my 30-second countdown. Somebody messed up my 30-second countdown, but I'll have to get that going for next time. But I believe people will start logging on here shortly. While everybody's logging on, here we go. People are starting to log on now. I will go ahead and well, I'll talk about some of our announcements quickly here as we get started. We've got a few things coming up we just had our PI conference in Huntington Beach. That was a resounding success. Tremendous speakers, tremendous venue. We had all the reports are coming back, all the pictures are coming back. Incredible. So if you didn't get a chance to join us for that, make sure you put that one on your calendar next year, because we'll definitely be bringing that one back, I assume. So I'll be looking forward to doing that again next year. But more importantly, what we have coming up is our fall conference, is our primary event coming up in August 28th through 30th. That's going to be at the Disneyland Resort Hotel. If you haven't stayed at the Disneyland Resort Hotel, highly recommend it. Incredible venue. The speaker lineup is going to be tremendous. We got Dan Murphy. We got Brad Glowacki. I'm trying to think of some of the other folks that are on the list. We've got a really cool speaker outside of chiropractic. Her name's Mandeep Johal. She works mostly in the dental space, but super good connector. Or she helps people make connections, and I'm really excited to see her speak. She's got over, I think, 60,000 followers on Instagram, so that's good. We're gonna have some good folks there to learn from and that kind of thing. So let's get started with today's content, because we do want to get through quite a bit today. Super important topic to bring to everybody's attention, and then we got to make sure we try to give away some money today. I believe we're up to $500. Is it right, Tiffany? Or usually people in the chat let me know what we're up to. But I think it's $400 this week. So that means 4 names, $400. And that's always fun, John. So when we get close to around 125, I'll let you know, just so we can try to give away some money today. So why don't you tell everybody, John, who you are? You and I have got to know each other quite a bit over the last few years, and all that you've done to help advance the profession of chiropractic.
Sure. And thank you, Dr. Dieter, and thank you for you fine folks in California for inviting me to this video conference today. I was out there in Sacramento last year. I think it was in April. And a very great crowd you had there, and very interesting and great conversation. And thank you for inviting me back. I am the lobbyist for the American Chiropractic Association here in Washington. Actually, we're across the river in Arlington. But I've been here now about 20 years. The picture you see behind me is my youngest daughter. I started here 10 days after she was born, and she's turned 20 now. So my career here is gone, so is hers. Yes, this is a very important subject right now. You're all seeing the news coming out of Washington right now. They're all dealing with that budget bill, and there's been a lot of debate this morning here about what can be in it, what can't be in it, and all that good stuff. So it's going to be a moving target until the day it is signed by the president, if it's signed. If it passes both the House and the Senate, and that is really up in the air as well. And they want to get it done by July 4th. So they've got this artificial deadline of next Friday to present it to the president. And the reason I talk a little bit about that is because that's taking up all the oxygen in the room. Everybody is very focused on that. The president is focused on it. The president is calling members and urging them to pass it and get it down to 1600 Pennsylvania Avenue. So, but we're also paying attention to another issue here in DC, and that's the Chiropractic Medicare Coverage Modernization Act. And I've got a slideshow that I'll bring up here in a second. But basically what this bill does is right now patients have access to one service in your office in Medicare, and that's manual manipulation of the spine to correct the subluxation, period. And there's only 3 codes associated to that. Well, you know better than I that you folks can do many more things that patient within your state scope that are Medicare covered benefits that those patients should have access to. And basically, that's what this bill does. It's a very simple bill. It just wipes out that line, that limiting language in the statute. And the reason we have a bill is because this is in statute. It was put in 1972, about 7 years after the Medicare bill passed. And it was put in, again, with that limiting language. And from what I understand, there's not many people around left that were around then that can tell me what happened. But basically what happened is that was a compromise between Congress, us, and others. So so we have to fix this because it's in statute. We have to fix it through legislation. We tried the regulatory process. We tried the regulatory process with 2 different secretaries of HHS, the one being Tommy Thompson from Wisconsin, who was very close to our Wisconsin folks. And most recently, Kathleen Sebelius through the Obama administration. And we met right in her office. We had great access. Folks in Kansas had a great relationship with her when she was insurance commissioner. And we sat with her and she got it. She said, this is crazy. Why is it this way? And she even assigned us a liaison to CMS and felt very good walking out of there. However, the HHS attorneys kept coming back and saying, look, this isn't statute. There's nothing we can do through the regulatory process. You have to fix it through legislation. So that's where we are today. This is the 3rd iteration of this bill. It's been in 3 different Congresses. And last year we had great support. We had 180 co-sponsors, and we were very close to getting it passed in committee and onto the House floor. And so we're back at it again. The ACA Board of Governors saw that support and didn't feel it was time to just give up. So given the great support we had and the enthusiasm among the chiropractic profession and our patients as well. So here we are again. And I'm going to bring up the slideshow here just a second here.
So just to kind of clue everybody in, we're talking about the Medicare Modernization Act. And one of the reasons that I wanted to bring John on was because I got a text message from Dr. Quinn James about how many sponsors are they up to now, John?
Up to 96.
96. And we still got a long way to go in the year. You know, I've tried to be helpful and instrumental in securing sponsors in last year's iteration of the bill. And we're hopeful that everybody here will help get us sponsors as well. And I can share with you what I've done and how I've done it even this year. So let's get your presentation up.
Okay. Yeah, great. Here we go. And just where we are today is you see that third bullet point, we're up to 96 co-sponsors in the House. We're at a pace ahead of the last session. And again, we had 180 co-sponsors last session. There's no magic number. People have asked me, what do we have to get? There isn't really a magic number here. However, the more support we have, the more co-sponsors we have, the greater the likelihood of our success. And that shows support throughout the Congress, for the chairman of the committee. The main committee of jurisdiction, again, is Jason Smith from Missouri. He was our lead Republican co-sponsor 2 Congresses ago. So he's very supportive. In fact, he handpicked a member of the committee to run this bill. That's Greg Stubbe of Florida. And again, he has introduced the bill in the House. On the same day, we also had a bill introduced in the Senate by Kevin Kramer of North Dakota and Richard Blumenthal of Connecticut. and we're up to 12 co-sponsors in that chamber. And so we're moving along, and again, the focus right now is getting more co-sponsors. And one of the things that we're doing through that, we're pushing out bulletins and so forth through our different communications channels. Again, we're focused on capturing our prior co-sponsors, because that's kind of low-hanging fruit. It's easier to co-sponsor a bill once you've co-sponsored it before. And again, we're getting the students involved as well. We've had high-level meetings with the sponsors and the lead committee chairs, and we're looking to plan another fundraiser for Jason Smith, the chairman of the Ways and Means Committee, hopefully in August. I know August is coming up pretty quick. It may be later in the year, but last time we did this back in 2023, we had it at Logan in St. Louis. We raised over $44,000 for the chairman. So we're looking to do something like that again. Going forward, our House of Delegates and our Legislative Committee, again, continue to push for co-sponsors. Jason Smith, he is our biggest supporter. He wants to get this done. So we're not going through a backbencher here. We're going through one of the most important people in the House. And every time I see him, he says, look, when this reconciliation, when this budget battle is over, we're going to look to pass some bipartisan measures. Well, there's nothing much more bipartisan than our bill. And again, I've got that on there. Once they get past this reconciliation, this budget battle, they're going to look to do some more bipartisan things. I'm going to talk a little bit about California. Here are some members that would be really, really helpful, because they're on committees of jurisdiction. And on the Ways and Means Committee, you have 5 members there, all Democrats, that are on the committee. 3 of them are previous co-sponsors, but have not co-sponsored yet. Again, that's low-hanging fruit. So if there's anyone here from Mike Thompson's district, Linda Sanchez down in Whittier, Jimmy Panetta, those are folks that would be really helpful if they can get back on. And even Judy Chu and Jimmy Gomez. Jimmy Gomez from LA was a newly appointed member late last session to the committee. On energy and commerce, you have 6 people. Energy and commerce has a slice of jurisdiction on Medicare. So once it passes Ways and Means, it has to go through there. And usually if it passes one committee, it passes pretty quickly through the other. But again, it would be great to have those folks on as co-sponsors. You see Representative Berrigan from LA, Doris Matsui, Kevin Mullen, San Mateo. He is a new member of the committee. Scott Peters and Raul Ruiz from Indio. Those are all folks that would be great if we could get those on. So those 11 folks I would really spend a lot of attention on. And I've talked to Dr. Dieter about this, and he's all well aware of all these members and how important they are to the process. And also, you have some previous co-sponsors from last session who have not co-sponsored yet. Ro Khanna, Zoe Lofgren, and Young Kim down in La Habra. So those, again, are folks that are previous co-sponsors, not on any of the previous committees, but they count as well. And so it'd be great to get those folks as well. And Dr. Dieter, I'll send you this PowerPoint after.
Yeah, so for sure.
You can.
And I know I need to get back to Jimmy and Zoe, because I secured both of those last year. And like in Jimmy's case, it was the first time he'd ever been in a chiropractic office. So that was kind of a cool experience, And I hear people in the chat talking about how Mike Thompson should be a co-sponsor. And yes, you do need to reach back out to them again to make sure that they secure their sponsorship in this session. Correct, John?
Yeah. And it's not like they don't support it now. The thing is to getting this to the top of their pile.
Yeah.
And it's a slog. Believe me, I deal with this every day. It's a slog to get this on top of people's pile.
And to your point, I had already talked with Jimmy's office and Zoe's office at the beginning of the year about sponsoring again. So now this is just another reminder to me to reach back out to their office and secure that. But I know we have Dr. Meg Spicer on the call today. She's from San Mateo area. I think Paul Marsh is from like San Diego area. So, we've got some people here that could simply reach out to these individuals. Kevin Mullen, thank you, Meg. Simply by just going to their website and sending them an email or trying to attend some kind of local event. That's the way that I did it, in terms of Jimmy and Zoe, just sending them emails and going to their events and that kind of thing. But I'll let you keep going, John.
Yeah, and we've got a legislative action center, and I'll get to that in a second, where you can do it right from there.
Yeah,
we've got a whole host of resources on our webpage, acatoday.org/Medicare, and it's right on our homepage. You just go to acatoday.org. It's right on our homepage. You can go to that page. You'll find all sorts of resources on how you can contact your member of Congress, what you need for a meeting, and even have your patients write these people as well. I find that a lot of members like to hear from patients as well. Again, this is a patient access issue. And I advise folks, if you do meet with your member of Congress in town, in your hometown somewhere, we all know the issue of Medicare reimbursement and how bad it is, but don't bring that up. Bring up that this is a patient access issue above anything else. You start talking about reimbursement, and for whatever reason, it turns them right off. But if you start talking about patient access, which is a very important buzz term here in Washington, they'll listen to you. You'll get your point across that way. And of course, with greater access will come greater reimbursement. So it's a patient access issue first, and get your patients to get involved as well. You can send that link that I'll show you a little bit later. Send that. We have a patient letter that patients can send in themselves. So there's all sorts of neat things that we have on our website that you can put posters up in your office and all that kind of good stuff. So, and this slide, I call this the one big beautiful slide from taking that from the administration. But this just rather shows the reach, the tentacles, and what is all related to Medicare. I don't know if you probably can't see all those.
It's tough. Yeah, it's tough.
All those agencies and so forth. But it touches so many things. It touches private healthcare as well. You folks have heard more than I have that private insurance goes as Medicare goes, and Medicare, or private insurance sometimes will cover only what Medicare covers. And if that's the case now, it's not a good benefit. However, if you can practice to the fullest extent of your licensure in Medicare, as this bill will allow you to do, all of this falls into place. It's just a very good way to put us on par with other Medicare providers in Medicare. We are the only one that I know of that are handcuffed by this statute. I have not found a statute or a regulation that really handcuffs access to a provider like the chiropractic benefit in Medicare. I have not found it. Maybe there is one somewhere buried deep in the bowels of those regulations or HHS. But, this is just to have that one service covered where you can do so many more things. You can't even now order an X-ray. If a patient needs an X-ray, and if you can get if you can do X-rays in your office, that patient has to go across town to an MD or a DO, someday have those X-rays returned to you, and by that time, who knows what kind of pain that patient is in. So it's a clear cut. I think it's just a technical correction bill to me. It's a very simple bill that hopefully we get passed. And as you talk about, again, contacting your representatives and senators, you can take a screenshot of this QR code, and that'll take you right to the site. Again, go to acatoday.org/Medicare. You will find all the information. And again, everything is done. All it takes is a couple of mouse clicks to contact your member of Congress. It's very quick, very easy, and it's immediate. And that's the gold standard now with congressional offices. When I was there on the Hill, I hate to show how old I am, but the gold standard was the written letter, okay? But now it is these messages that come in electronically because they do a count. And the more these messages we have into Capitol Hill, when they have their weekly staff meetings with the boss, they say, well, gosh, Congressman, I've gotten 89 messages on this chiropractic bill. And that's how they go on. They see their support within their community from their constituents, and that's what makes it happen. I'm going to stop there, Dr. Dieter, and
we got a couple of questions, John.
Okay.
Just because let's leave that QR code up, Tiffany, just for a little bit in case anybody.
Okay.
Or I'm sorry, that's you, John. I want people to be able to scan that, or I just want to reiterate to everybody how simple of a step this is to take. And we've got 27 people on the broadcast right now. I'm sure as they know we start giving away money, we'll have a few more people on the broadcast here shortly because everybody starts texting their friends. I just wanted you to speak quickly about, everybody. I keep here. As I've gotten involved more in this, everybody's like, well, this bill doesn't have an opt-out, and I wanted you to speak to that quickly about that, because certainly you've put my mind at ease about that and answered that question to my satisfaction, so much, so that I was able to, I felt comfortable going to get support from those legislators. So if you could just speak to that real quick.
Sure. Yeah. We'd love to be able to opt out like other providers, especially physician level providers. We're the only physician level provider that cannot opt out of Medicare. And you can't run the two on parallel tracks. I can't go into a congressional office and say, oh, yeah, I want greater access. Oh, there goes my lights. Hold on.
You're good.
All right. There we go. It's hard to go in a congressional office and say, oh, yeah, I want greater access for our beneficiaries in Medicare. Oh, and by the way, I want to be able to opt out. I put on my congressional staffer hat. I say, well, which is it? What do you want? You want greater access or being able to opt out? So you can't do it that way. Once this is done, however, I think we go for that. We definitely go for that. And if there's opt-out legislation in there, out in Congress, we would support that. But we got to support this first, because it's going to be one of these things. Well, what do you want? Do you want to be able to opt out, or do you want greater access? I think the greater access right now, we get that. We again become on par with other Medicare providers, and then we can go for the opt out. But we got to get this greater access first. We got to make sure that you can practice again to the greatest extent of your scope and your licensure.
I appreciate that, because that always comes up in conversations that I have with people, and I know there's some concern about that. But like I said, to me, I certainly agree with you that it's this step first and then the next step type of thing. I did see a question here real quick about how are you handling opposition and opposition letters? Maybe Marissa, this is Dr. Marissa Palmer. She's the board member in charge of GA for us. Maybe you and Marissa can connect on that, and we can address that. Unless you have a quick answer.
I can tell you quickly that yes, the the AMA and the osteopaths have again raised their ugly head in opposition to this. However, their opposition has been met with a big thud on Capitol Hill. AMA is not in great favor with Congress right now.
Yeah.
And this kind of these antics really are not appreciated on Capitol Hill. I can tell you. In fact, there was a communication from the office of our lead sponsor, Greg Stubbe, to the AMA, and saying that it's the AMA that has put us in this type of situation to begin with, and you should be welcoming this. And this is a family chat, so I won't say what else went on, but yeah, they were pretty much showing the door with that type of opposition. We do hear it begin. There are folks, but once we explain it to other members of Congress, they get it. Yeah, it's the opposition has really just been from the AMA and the DOs, and so it's but again, their opposition is whenever I raise it with a staffer, they just roll their eyes and go, yep, that's what they do. So
yeah, that's great to hear, John. I mean, I think we run into a lot of that same thing, just opposition for opposition's sake, and so I think right now we're in a better time than ever with the changes at HSS and with the MAHA movement to advance chiropractic, and so I really encourage everybody on the broadcast today, just take a minute to go. Paul Marsh already said he took care of that for us. I really appreciate that, Paul, for taking those steps to make those clicks, to send those letters out. If you're willing to print the materials and put them in your office for your patients to take action on, that's even a better step you can take. And I really encourage you just to ratchet up your involvement just that little bit more, because I agree with John. Like if we can just push the number of sponsors, how many sponsors do we need, John, to force it to a vote?
Well, it's the official is 290,
Okay.
but to bring it to the House floor. However, it's going to be hard to get that. I've not since they put that rule in the House, I've not seen it happen. So getting 290 people on a bill is really hard. But
so what would be the thing that would get us to a vote? Because I know you said we were close at 180 last year.
Just more. Just keep on keeping on.
Okay.
Just adding to that number, adding the Ways and Means members and the Energy and Commerce people that I showed before. That makes it very easy for the chairs of those committees to pass the legislation once they see a lot of their colleagues on both sides of the aisle on this thing.
That's awesome. Okay. Well, let's, everybody try to take an opportunity to do that. It'd be greatly appreciated. Appreciate your support, John. You going to try to stay on as we try to give away some money today?
Sure.
All right. Well, we got 4 names to spin as Tiffany's getting the wheel up. I want to remind everybody, as Paul just told me, that we also at the fall conference have a work comp track, and that's going to include some additional key speakers for you. And then we'll have to go back and read the names that he said, but we also are going to be having Paul or someone from the work comp committee on soon just to talk about all the things that they're doing as well. So we'll keep reiterating that, or keep reminding me, Paul, to reiterate that, because I think that's an important thing to keep reiterating. John, if you could stop sharing your screen, I would appreciate that.
Okay.
And then we will, can CalChiro email us this QR code so we can display it in our offices? Marissa, if you go to the ACA website, you will see the materials that you can print to put in your office. Super professional, super clean. Highly recommend you print the information sheets and the leave behinds that the ACA has created and email those directly. I mean, at minimum, if you can take this step by scanning the QR code and doing the voter voice point and click thing, that's the minimum level of effort. If you can download the information sheets and the leave behinds and email them or drop them off at your legislator's office, that's the next step that you ratchet up. If you can get a meeting with them or get them on the phone or invite them to your office to show them what we do, why we do it, that's even better. So I think that's the level of effort, that you can do the minimum level of effort, or, I tend to be a little nutty when it comes to these things, John. So I try to overachieve, I guess. But let's try to give away some money today. We're running a little over on time, but I think it's an important topic and really appreciate it. You coming on, John. Michelle Miller, you are named number one. Michelle Miller, you are named number one. You have 30 seconds to come and claim your prize. As a reminder, you have to be a member that is in good standing. So your name's in the digital canasta here, and you have to be on the broadcast, and you have to say that you are here in the chat within 30 seconds to claim the money. I think most people are getting pretty familiar with how we do this, and I'm really grateful to all of our regular listeners. Please take an opportunity to share this with your friends, your colleagues, what we're doing. Even if they just like and subscribe to the channel, that helps us in the algorithm. That would be greatly appreciated. If you're having district meetings or other events, please bring it up at those events as well, just so that we can give away more money and increase our listenership. So let's do name number 2. I think Stephen Cohen. I think I just saw something from Stephen Cohen in another Facebook chat or something like that. So Stephen Cohen, you are our winner. And let's see if you're here to collect your money. You have about 17 seconds to collect your money. I would also remind you that we have local district events coming up in probably in some of your areas. So make sure you're checking out your TWA and you are looking for the events section of your TWA. If you don't know what the TWA is, it's the weekly adjustment. It's your member newsletter that you get every week in your inbox. Many of you are going to tell me, oh, I don't get that because that goes into your promotions folder. So make sure you're looking in your promotions folder to keep yourself updated. And even if you can change the settings on that email so it goes to your main inbox, that will help you to make sure that you get the regular correspondence from the home office. So doesn't look like Stefan's here. So let's do name number 3. Kimberly Portillo. Kimberly Portillo, you are name number 3. Let's see if you're here to collect your money. I love all the questions in the chat today. This is awesome. The interaction. Lots of questions for Paul about how do we get a beginner's course in work comp. And Paul is right there to start responding. I appreciate that. Is there some kind of QR code for the QA session on 7/24? Maybe we can put that up, or if there's a link that people want to attend that QR or that session, that Q&A session on 7/24. Oh, that's what you're talking about, how you're going to be here, Paul, on my broadcast on our broadcast on 7/24. So now I get it. But yes, fall conference will be a perfect time for you to get a little more information about the beginner's course on treating work comp. So I don't see Kimberly Portillo here with us on the broadcast today. So let's do name number 4. If we don't have to next week, Mitch Patterson, you are name number 4. Let's see if you're here with us on the broadcast. Once again, everybody, thanks so much for being with us. Fall conference, don't forget that coming up, including the work comp piece of it. Until then, make sure you're checking out your district events. We have a number of different things going on in our Santa Clara district with some of our sponsors and things of that nature. So I know there's lots of opportunities to connect with each other and support each other. I think that's the biggest key, that as we move forward, continuing to provide that level of support for each other as a profession, just agreeing on the fact that the adjustment is a good thing, I think gets us moving forward. So thanks so much for being on today's broadcast. I don't see Mitch here with us, but next week we'll be back with $500. And until then, we'll see you.